Hello, how are you today?
Hi, I'm doing really good. How are you?
I'm good. So, I would like to ask you the questions about the hospital and the recovery. What did you do for the first day before the surgery?
So the first day when I got to the hospital was all the admission. I believe we did blood tests, we did the EKG, we did chest scan, and then I believe that was it for the time being. I was also off of food. I wasn't able to have any food. Well, except for this like liquid soup kind of stuff. I don't know how to describe it. It didn't taste good or bad. It was food. It was something to put in your stomach to get through the day. And then I guess after the first day, we started doing, so this would be the surgery day, we started doing the liquid laxative, which was 2 liters. Tastes awful. It really does. I don't have the right words to describe it. It almost tasted like salt water mixed with something bad. Plug your nose to drink it and try to drink it fast, but not so fast that you make yourself sick. Another thing that we did was a few enemas as well, just to clear everything out and make sure that everything was nice and clean on the inside.
For the 7 days that you stay in the hospital, how did it go?
If I'm being honest, I don't remember a whole lot of the first day or two. I had heavy painkillers, so I didn't feel too much, and I was sleeping for most of it. It's not the most comfortable being stuck laying on your back. I found it worse because I'm usually a side sleeper, so trying to sleep on my back was difficult, but it's doable. I had to stop taking the heavy pain medication though, because it was making me very sick, which was causing a lot of pain, so we stopped all of that. And then a few days later, my IV stopped working. I think it was because my hand swelled up. I'm not exactly sure why, but they took my IV out at night, and after that I was able to start with some water. And the following day they had brought me this mixture. If I'm being honest, it tasted like children's cough syrup. So kind of like cherry flavored medicine. It wasn't bad, but it, I guess, keeps your electrolytes up and keeps you hydrated. Again, I was on and off sleep. I was tired a lot. I was sore. The whole time I was trying to kind of gently shift myself in the bed just so that I could get some relief while I was stuck. The following day, I was brought some more food, and by food I mean more of that liquid soup, which again didn't taste good or bad, it just was something to eat. So because I had the IV removed, I was able to also start all of the oral medications as well as the painkillers. After that, things started getting a lot better. I was more comfortable. I could move both of my hands freely. I didn't have to worry about bumping my IV. And then on the Friday, which was my last day in the hospital, I believe, they came earlier in the morning and did a little checkup, see how I was doing, and removed both the bandages and the packaging and the blood drain. I think the most painful part was removing the bandages, just because some were a little stuck to me and I was pretty bruised around the bottom, so that hurt a little bit, but you know, just hold on to something tight and get through it. You'll get through it, I promise. But after that, I was finally able to see my new vagina for the first time, and that was the best experience ever. I immediately started crying. I grabbed the doctor's hand and I thanked him like a billion times. And then I spent the rest of the day crying happy tears because I finally did it. I finally gave myself the freedom and the life that I've always wanted.
How was the recovery after the hospital, and like how is the place where you get the recovery?
So after the hospital, I went to my care facility, which honestly is the place I'm staying at is a very nice condo. It's got everything you need. There's multiple bathrooms, multiple bedrooms, handrails where you need them so that you can get up and down. I was also able to slowly start having real food, and honestly, it could not have tasted any better. It was probably my favorite part. The pain was still pretty high, but it was manageable. I was very slow, but I could walk. I just had to take it easy. No sudden movements, steady feet. The pain meds were still doing their job. The medicine became a daily habit. I'm now used to it.
How many days after the hospital and recovery could you walk?
So I think we started doing a little bit of walking the day before they removed the packing while I was still at the hospital. It was a very small amount, but it was still nice to get up out of bed. The day that they removed the packing, I later walked around the nurse station about 4 times. Now everyone's different, so it may not be the same, but I tried to push myself a little bit there. And every day so far, I've gotten better with walking. I've been able to do more. I've been able to very slowly bend and reach, and my mobility has improved greatly. I'm still not 100%, but I am only 10 days after, so it's only going to go upwards from here. Last time we talked, I think it was 10 days after my surgery. I was still feeling a little rough. Today is almost 3 weeks after my surgery. I'm feeling a lot better. I can sit cross-legged, which is quite wonderful. I've been up and about, moving, doing a lot more, honestly a lot more than I even expected I was going to be doing. I can walk, I can do stairs, I've been shopping, I've done some tourist kind of things. I've visited the elephant sanctuary and some tiger parks, gone out to a whole bunch of different places for dinners, lunches, and breakfasts, as well as I've just had some lazy days, and recovery has been going really well. Dilation I can finally do by myself, as well as the douching, cleaning, all of that. Things are healing really well. My swelling's gone down quite a lot. I'm actually surprised at how quick it's gone down. The little bit of necrosis I think I mentioned last time is gone, so everything is now pink and pretty. I think things are going pretty smooth.